If you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions. Hi everyone, this is Nurse Anna from nursestudy.net, and we're going to do our first little quiz. It's going to be cardiac themed, and we're just going to see how this goes. And if you want to see more of these, just please make a comment down below and let me know what you think. I think this will help you kind of put things together and remember little things here and there. You just keep doing these testing and sessions all the time, and your memory will get better and better. So our first crossword puzzle will be cardiac themed, and we have 18 I guess clues that will go into the boxes here. So the first one's going to be a waxy so two across, so right up here, a waxy substance that can build up in the arteries. And I'm going to give just a few seconds before I go ahead and let you know what it is. It's cholesterol. So cholesterol is a fat-like substance. It's a lipid, and it's made by the liver and also found in certain foods. It's essential in building cell membranes, producing hormones like estrogen and testosterone, and making vitamin D. There are two types. There's LDL, low density lipoprotein, which is that bad cholesterol, because too much of it can build up into the arteries and cause some blockages. And then there's the HDL, high density lipoprotein, and these are known as the good cholesterol, and this helps remove excess cholesterol from the bloodstream. So next will be 4 across, which is another word for high blood pressure. This one's obvious. I think I hit this one in the last crossword puzzle. And it's hypertension. So hypertension or high blood pressure is when the force of blood against the artery walls is consistently too high. And it's often called the silent killer because it may not cause noticeable symptoms, but increases the risk of heart disease, stroke, and even kidney failure. So that was hypertension. So 6 across here, chest pain due to reduced blood flow to the heart. Okay, that's angina. So angina is chest pain or discomfort that happens when the heart muscle doesn't get enough oxygen-rich blood. It's a symptom of coronary artery disease, CAD, and often feels like pressure, squeezing, or tightness in the chest. That's angina. Now it's important to remember there are 2 types of angina, and one is stable angina. This is predictable and occurs with exertion or stress, and it'll go away with rest or nitroglycerin. And then there's unstable angina, or angina, however you want to pronounce it. Unstable angina is unpredictable and can occur at rest and may signal a heart attack. This is a medical emergency. So the next one is going to be 7 across right here, and that's fatty deposits that can narrow arteries. Okay, plaque. So plaque is a sticky fatty substance made up of cholesterol, calcium, and other substances found in the blood. It builds up inside the arteries, especially the coronary arteries, and causes narrowing and hardening, a condition called atherosclerosis. This buildup will reduce blood flow to the heart and can rupture, forming a blood clot and potentially causing a heart attack. That's plaque. So we're now going to go to 11 across, disease of the heart muscle. So that's a long one. So disease of the heart muscle, and it's 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14. Got it? Cardiomyopathy. So cardiomyopathy is a disease of the heart muscle. It makes it weakened, enlarged, and thickened, or even stiff. This affects the heart's ability to pump the blood effectively. So that's cardiomyopathy. Looks like it shifted a little bit, but trust me, that's where it fits. So our next one's going to be 13 across to tissues. I'm sorry, reduce blood flow to tissues. Ischemia. Ischemia is a condition where there is reduced or blocked blood flow to the part of the body, usually due to a narrowed or obstructed artery. This leads to a lack of oxygen and nutrients needed by tissues, which can cause pain, tissue damage, or cell death if it's not corrected. Now, since we're talking about the cardiac system right here, cardiac ischemia can cause angina or a heart attack. But just so you know, you can also have cerebral ischemia, which can lead to a stroke. So that was 13 across. 14 across. Now this one should probably be easy. So right here. Heart valve located between the left atrium and the ventricle. I'll give you a second. Okay, mitral. The mitral valve is one of 4 heart valves located between the left atrium and the left ventricle. It allows oxygen-rich blood to flow from the left atrium into the left ventricle and prevents backflow when the ventricle contracts. Mitral. So now we will go to 16 across. Right here was a long one also. Inflammation of the heart's outer layer. Okay, inflammation of the heart's outer layer. Pericarditis. So pericarditis is inflammation of the pericardium, thin double-layered sac that surrounds the heart. So we're all around here. The inflammation can cause chest pain, which is often sharp and worse when lying down or breathing deeply, and may lead to pericardial effusion, and that's mainly fluid buildup in the sac. Pericarditis. And I guess our last one for cross would be 18 across, abnormal heart rhythm, right here. Arrhythmia. An arrhythmia is an abnormal heart rhythm, meaning the heart beats too fast, tachycardia. That's usually over 100 beats a minute. Or too slow, bradycardia, usually under 60 beats per minute, or irregularly. It can be due to a problem with the heart's electrical conduction system. Common types include atrial fibrillation, or AFib, which is irregular, rapid upper chamber rhythm. Ventricular tachycardia, which is fast, life-threatening rhythm from the ventricles, and bradycardia, which is an abnormally slow heart rate. Usually below 60, however, some athletes kind of live below 60, and that's normal for them. So now we're going to go up here to 1 down, and that is going to be narrowing of a heart valve or blood vessel. So we have part of it here. Stenosis. So cardiac stenosis is the narrowing of a heart valve, which makes it harder for blood to flow through the valve. This forces the heart to work harder to pump blood, and over time it can lead to heart failure or other complications. Common types include aortic stenosis, which is, just like the name implies, narrowing of the aortic valve, or mitral stenosis, which is narrowing of the mitral valve. So now we're going to go to 3 down, which is here, and it's relating to the heart muscle. That's not really a good clue, but that's what it is. So relating to the heart muscle, and it's 3 down. Myocardial. The myocardial muscle, or myocardium, is the thick middle layer of the heart made up of cardiac muscle tissue. It is responsible for the heart's pumping action, contracting to push blood out of the heart and relaxing to allow it to fill. It is an involuntary striated muscle. It needs a constant supply of oxygen to function, and damage to this muscle, like in a myocardial infarction and myocardial heart attack, impairs the heart function. Myocardial. So now we're going to go over here to 5 down. which is inflammation of the heart's inner lining. Well, we already had this one, so this one should be endocarditis, and it is. So endocarditis is an infection of the inner lining of the heart called the endocardium, usually involving the heart valves. It is most caused by bacteria entering the bloodstream and attaching to damaged areas of the heart. So the key risks are damaged heart valves, artificial valves, IV drug use, and recent dental or surgical procedures. Endocarditis. And so now we're going to go to 8 down, which is over here. Phase of the heart when the heart relaxes. That should be very easy. And that should be diastole or diastolic. Diastolic refers to the phase of the cardiac muscle when the heart muscle relaxes after contraction. During diastole, the ventricles fill with blood from the atria in preparation for the next heartbeat. It is usually the bottom number of the blood pressure. Well, it's not usually, it is the bottom number. So blood pressure 120/80, 80 is the diastolic reading. So now we're going to go to number 9. 9 down, they kind of got shifted a little bit, but it looks like it's a larger word. And it's slower than a normal heart rate. We've mentioned it a couple times already, bradycardia. Bradycardia is a slow heart rate, defined as a heart rate less than 60 beats per minute in adults. But like I said before, this can be normal in healthy individuals like athletes, or abnormal if it causes symptoms or results from heart problems. So possible causes of bradycardia are aging or heart disease, medications like beta blocker, digoxin, hypothyroidism, or electrolyte imbalances. So that is bradycardia. Number 10 down, right here, type of heart failure with fluid buildup. And I think I know what that one is, and you should too. Congestive. So congestive heart failure is a chronic condition where the heart is unable to pump blood effectively to meet the body's needs. This leads to a backup of fluid in the lungs and or body tissues. So we have left-sided CHF or left-sided heart failure, which causes pulmonary systems like shortness of breath or crackles. But then we have right-sided CHF or right-sided heart failure, which causes systemic symptoms like edema or JVD, jugular vein distension. So next we're going to go to number 12 down. Let's see right here. And that's the largest artery in the body. And that one is the aorta. We all know that just from, oops, where are we? Yes. So aorta. So the aorta is the largest artery in the body. It carries oxygen-rich blood from the left ventricle of the heart to the rest of the body. So there's some key parts of the aorta. We have the ascending, the aortic arch, and the descending aorta. And then from there it branches off into smaller arteries to supply blood to the brain, arms, abdomen, and legs. Okay, so that was the aorta. And then we have 15 down, rapid or irregular heart contractions. Right here. And that's fibrillation or AFib or atrial fibrillation. And this is an irregular and often rapid heart rhythm that starts in the atria, upper chambers of the heart. Instead of being normally, the atria quivers or fibrillates, which can reduce how well the heart pumps blood. The risk factors for this are, this can cause blood clots, which could cause a stroke, and it can also cause heart failure. Common symptoms would be palpitations, fatigue, shortness of breath, dizziness, and causes could include hypertension, heart disease, hyperthyroidism, and it can also happen post-surgery. And so for our final, it'll be 17 down, phase of the heartbeat when it contracts. So we already have this one here. So this one is, systolic. So systolic refers to the phase of the cardiac cycle when the heart contracts, specifically the ventricles, to pump blood out of the lungs to the rest of the body. It is the top number of the blood pressure. So 120/80, it's the 120. And it reflects the pressure in the arteries during ventricular contraction. So we have finished our first crossword puzzle, our first whole crossword puzzle. I did a live if some of you guys saw that. I was just testing it out. But basically, I kind of thought this was like a fun way to it's almost like a trivia for the cardiac system to like kind of trigger your memory and just kind of, take things a little easier, maybe in your car listening to this, or just, kind of watching this and figuring it out. They shouldn't be too long. But I really do hope you enjoy this, and I really do need your feedback. So if you could leave a note or comment and let me know if you want more of these. I'm probably going to be doing more of these anyway, just to kind of see how they go. And then leave a like, and don't forget to subscribe. And this is Nurse Anna from nursestudy.net, and we will see you soon.